The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. We are excited for our guest today, Dr. Carlie Yearsley, who is a nurse practitioner, and we're excited to have her tell us everything about birth today.
Carlie Yearsley has been a certified nurse midwife and women's health nurse practitioner at Altaview Hospital in Sandy, Utah for over 12 years. She earned her doctorate degree in nursing at the University of Utah, specializing in women's health. She helps women of all ages and feels it's important to individualize care and has been through hardships herself, losing a son to cancer and suffering from mental health. She uses her past experiences to provide empathetic and compassionate care to others. Thank you so much for being here, Carlie.
Thank you for having me.
We're so excited to chat with you about all things midwifery and labor and delivery, but you have really dedicated your career to the women that you serve. Can you just share a little bit briefly why you wanted to become a midwife?
That kind of came down the road. When I was in nursing school, I always felt drawn to women's health, and I received a brochure in the mail from the University of Utah for the nurse practitioner program in women's health, and so I knew that I always wanted to do that, and so I worked as a nurse for 2 years and went on to grad school. While I was there, I realized how much I love labor and delivery aspect of it, and so I added the midwifery program to my degree.
That is so fascinating. Can you walk us through some goals that women could have as they prepare for labor and delivery?
Some goals they may have. I think it's important that women think about what their birth process looks like and what they want for their experience. Do they have a supportive team with them, maybe their partner, their mother, their sister, friends, through the process? So goals of, do I want to go unmedicated, meaning no epidural, no pain medicine, but alternative approaches to help them through the labor process. It's also important that with their goals, they reach out and find a provider that they mix well with, because you're going to be with that provider through that whole special time in their life, the pregnancy and labor and birth, and then postpartum. So if they're not gelling well with the provider, that's really going to affect their goals for their birth experience.
You're going to be working with this provider for about a year and finding someone who can help. I think the term patient-led care is one that's really coming up these days. As a first-time mom, you don't really know what to expect.
No.
How can you marry a little bit of the birth education and then finding that right provider in a way so that you can set some goals for your birth that you can honor?
Yeah, so at our clinic, and I know other midwifery practices do offer meet and greets where you come in, ask all your questions. It's not about your health history or anything like that. It's basically asking the provider what their philosophy is. Are they supportive of a more patient-led experience? Because you easily can get to know the person and realize, I'm not feeling it with you, or yes, I really want you part of my team.
And what are some reliable sources where women can find providers or find education about what their birth experience could look like?
Yeah, I think social media, there are pros and cons where you can, word of mouth is huge. And when women post about their birth experiences, that definitely helps women, give them a little resource, a big resource actually. If they're looking for midwifery care, the ACNM website usually has a list of midwives in the community. But I would also tell them to be cautious about midwives, obviously going to meet them and finding out what their philosophies are. But in the community, midwives who maybe don't have training, that's where I get a little nervous about women going to them. If they're thinking of like a home birth or a birth center, just getting to know those midwives as well. But word of mouth is probably the biggest way women find the provider that works well for them.
And when you have a midwife with different credentials, does that essentially mean they have different experience in delivery, or that they are not trained in certain elements, such as like suturing a tear?
All of the above. Certified nurse midwife is the highest level. That is either a master's or doctorate degree prepared midwife. And they're accredited through ACNM and AMCB, and then there's certified midwife. So certified nurse midwife, we were nurses beforehand, and then we went on to grad school. Certified midwife was not a nurse before, but still has training. And then there are other midwives at different levels. It really is based on their education level and experience, like you said. I would tell women to be cautious because there are some midwives who you can use the term midwife and say that I'm a midwife, and they don't have any experience or any education. So I always cautious women about that.
Can you tell us what ACNM stands for?
It is American Certified Nurse Midwife.
I was kind of trying to guess some of those letters, so yeah, that makes sense.
I've been a part of it for years, and I'm like, oh my gosh, what is it?
What is ACOG? I know I've heard that thrown around too.
Yeah, American Gynecology Obstetrician. We do use a lot of their resources, and we do practice following a lot of their regulations and recommendations, national recommendations. Mm-hmm.
So when you're helping to prepare a mom who is getting ready to have a baby, I feel like it's impossible to explain like what a contraction is going to feel like, right? So what are some of the things that you do with your patients so that they're starting to feel comfortable with the pain management techniques that they're going to put in play for their labor?
Education beforehand is vital, but like you guys said, especially if it's your first baby, you just don't know what to expect. And I think a lot of them think that the initial Braxton Hicks, the tightening of the stomach, think that that's what the contractions, surges will feel like. So education before, during their visits, and then early in the labor process, we talk about how this is what you should be, you can expect to feel. It could start in the lower back, could feel like menstrual cramps, and then it becomes the tightening. Everyone's a little different. I try to get them in an early phase. I'm okay if they take a nap. I want them to have energy. So sometimes I'll have them just lay in the bed and relax. And then as things start to pick up, then I say, okay, up out of the bed, let's get you walking. We have exercise balls. We have squat bars, birthing stools. We have showers and tubs to labor in. We don't do water births. I've heard a rumor that is a possibility with Intermountain, that would be down the road.
And you have such a unique practice right now because it's midwives who are practicing at the hospital. So you also have access to everything that a hospital could provide, such as an epidural. When we talk about pain management, though, are there other options?
Other options, yes. So when women come in, obviously distraction, under pressure, different position changes, walking is really great. And then once things really start going, Altaview Hospital, we offer, it's new within the last year, it's nitrous oxide, which is laughing gas. They can use that with a mask during the contraction, and then they take it off after to kind of relax and breathe through, and then the next one. So they have that option, which a lot of our patients have really liked. And then if they decide that that's maybe not helping as much, we can offer pain medicine through the IV. We're very cautious about giving that if we think that birth is imminent within the next hour, because it can affect respirations of the baby. And then, of course, the epidural. That is a catheter that goes in the epidural space of the spine in the lower back. And there's no needle in the back. That's just to place it. And then it gives them some medicine. It kind of bathes the nerve endings so that it numbs, usually from waist down. At our hospital, I feel like our anesthesiologists are really good at giving a combo where they're not super dead leg, but you do have to stay in the bed for that. And we still try to do all of our techniques to help bring baby down, continue the labor process. So a lot of position changes, but yeah, you're still in the bed with epidural. So.
With your hospital, do you have to opt to have a midwife, or is that just the practice for all patients?
That's a great question. Yeah, so they have to opt to have a midwife. They would come and see our practice. They can transfer to us at any time. Most women see us from day one. If at any point we feel like their care is higher risk, then we may co-manage with one of our physicians or transfer on. If we need something like a vacuum or forceps or a C-section, then we talk with our backup physician. They come in and then we proceed with that. I feel like we're really good at talking with the patient and telling her that these are concerns we have throughout the process, so that it's not just a big, okay, we're going to C-section, I don't have time to tell you why. I think in most cases we're really good at that. It's more on the rare side that we have to do that.
And in talking about these higher risks or just parts of labor, what are the elements we can control?
Yeah, I think that's a really hard question because I think as women, we want to be able to control every situation that we're in. In the pregnancy, labor, birth process, you can't control every little thing, but we give them a birth plan during your pregnancy so that they can see the different options they have. And then I always tell them to write questions they have and then bring it to the next appointment so we can review over it, address any questions they have, and then always bring it when they come in labor. And so that we can be all on the same team as with the nurse that's there at the hospital. But trying to be in control of the whole situation can be kind of difficult. And I try to tell women that we'll do our very, very best. In the hospital setting, we're definitely probably more on the conservative side than the birth center or a home birth.
I want to talk about the exciting part, either pushing the baby or for you, catching the baby.
Okay.
So one of the things that is an unexpected sensation is the feeling of your baby getting ready to push him or her out. So to me, this always felt like I had to poop. And I've heard from people who have an epidural that that is not the same sensation, that they don't really have that. But a lot of people will ask, when am I supposed to push? And I like to tell them, like, you're going to start pushing when you feel like you have to go to the bathroom.
Yes.
At this point, are there certain positions that you can get in so that the pushing is more comfortable? Do you recommend that we stay in the same position, or that we're kind of changing in between contractions for our baby's descent?
That is a great question. I just talked to one of my partners about this yesterday. First, I want to address when to push. So I know there are going to be a lot of providers out there that don't like what I have to say. Research has come out and said that rest and descent, you may have heard of that, where once you're completely dilated, we still wait until you feel more of a pressure down there. Research has come out and said that doesn't speed the birth process along. For me, that's not why I'm doing it and recommending it. I feel like when we start pushing too early, it can stress mom out, fatigue her, can stress baby out. And the concerns I have with that is it could lead to C-section. And I'm not saying C-section is a bad thing. I'm grateful we have that option. I think, though, by allowing the mom, her uterus to continue to bring baby down into the pelvis, into the vagina, and then when she feels that pressure. Now, with an epidural, depending on how heavy it is versus how light the medicine, sometimes you really can't feel down there. I try to do a little sensation in the perineum to help women know, like, let's guide our efforts down in this area. But a lot of times they can still feel some type of pressure. I feel like when they can feel that pressure, their pushing efforts are so much more effective.
If we're starting to feel that pressure, and so we've pushed through a couple of contractions and the baby hasn't come, do we need to change positions?
If they're unmedicated, I love hands and knees. It's more messy, less controlled for the person catching, but there's so many benefits to it. However, if she's not liking that position, we try a different position. If you have an epidural, it's harder because you're in the bed. Laying on the lithotomy position, that where we're used to seeing them on their back with knees back, that is an easier position for the provider and for everyone there. But laying on your side can be really beneficial for women. We do know from research that is less likely. The tearing may not be as severe. The sideline.
Some benefit for your pelvis so that you're not actually like sitting on that tailbone while you're trying to push the baby out.
Right. Yeah, definitely more benefits to that. For women who have epidurals, though, I think that probably fills the easiest position, though, versus a sideline where they've got one leg up. I try different positions that help the woman feel like she's in a more comfortable position. It's easier for her. Now, if we're making great progress and the baby's doing great and she's doing great, we may stay in that position. There's a lot of factors for that.
I know when I, was able to have a baby and have that little baby like placed on my chest, it just felt like the most love that I've ever felt.
Okay.
Do you have a sense of that as well as you are helping this baby come into the world?
It is such an amazing moment for that woman, and I think the baby, and the couple, if the partner is there, and if they're involved, that it just brings such an amazing feeling in the room. I always feel bad when women say, "Thank you so much for delivering her," and I was like, you did it all? You're the rock star. I was just there to catch babies. But yeah, it is a really amazing moment. And I'm so glad you had that experience, because with my experiences, I feel like that was the start of my mental health journey. Bonding was impacted. And so it makes me really happy when I hear women say, like, this is the greatest thing I've ever felt, because I never experienced that.
Well, and let's also address that, because in the same way that a woman might feel like her body has failed her if she has to have a C-section, maybe you feel that same way if you're not overwhelmed with the hormones and the positive emotions when your baby is born. Yeah. You might just be feeling complete exhaustion.
Yeah.
And it's okay to feel all of those feelings, and your bonding will come with time.
What I would say to that is, if you feel like bonding is being affected, please speak to your provider about it. My first baby, I did not tell anyone, but I didn't understand, because all my friends were having babies, and they were just elated, and they were just the cutest moms, and I thought, I'm not feeling this. And I even hate to say this, but my first, I don't feel like I could say that I truly loved her until about a year. That kills me as a mom. I didn't realize, though, that I had severe postpartum depression at that point. So I would tell women, try to hold it in and hide it. Come see one of us. Come see a provider that, really knows what they're doing with postpartum depression, because I want them to feel that love for their baby.
I love that you're able to look back and see those memories and have those moments. And I'm realizing while doing this podcast that I kind of left those events in the past and we're thinking, yeah, just the baby was born, it happened, and now let's move on raising them and moving forward. But it's nice to look back and reflect on those times too. I will link Sarah's video in the show notes of her third baby, her video. It is just so touching. And holding both of those, the magic and the beauty in birth, and then also the hardship and getting help and support as well.
Well, Carlie, before we close, I do want to ask you a quick question about menopause.
Okay.
Because some of us who are older women, I feel like we're going directly from our birthing years to our perimenopause and our menopause years. What do you recommend for us during this stage?
I am in the perimenopause phase, and wow, so I've been starting to do a lot of research. I've certified with National Menopause Society. No one really talks about menopause. We're really starting to hear more and more about it, and podcasts. The transition from the reproductive phase to perimenopause, I feel like there's, for me, a lot of similarities to when I was nursing. Vaginal dryness, mood changes, foggy brain. And so for women, hormone therapy can be a really great option for them if they are a candidate, which many women are, and it tends to really help them from the reproductive phase through the perimenopause phase, from when until they reach menopause, which is not having a period for 12 months, and then the post-menopause for the rest of their life.
And so we can access that therapy through our practitioner, maternal health.
If you're looking into hormone therapy or have questions about it, I actually just read this amazing book called The New Menopause by Dr. Mary Claire Haver. And very enlightening, and definitely what our generation needs to be reading right now to learn more about it, because there's a lot more symptoms to perimenopause besides hot flashes and vaginal dryness and changes in periods. But some providers are still cautious with hormone therapy because there was a huge study done in the early 2000s. The Women's Health Initiative, they received a lot of negativity about hormone therapy and the harmful effects. And what we're finding is that the media presented their information incorrectly. And so a lot of providers are still kind of old school, where they are really cautious and scared of hormone therapy. It really can be beneficial for women. It really can be life-changing as they go through this next event in their life.
We're so grateful for practitioners like you who can walk us through all of these stages of our lives and just give us the most care and the loving care. That's what I feel is so particular to you, is just the love that you have for your patients. Carlie was my midwife for my first son, so that's how I can speak to that personally. Thank you for coming on today and sharing all of this with us.
Thank you. My pleasure.
Before we go, we're going to share one Mom Squad secret from someone in our community. And this is from Erin. She says, affirmations are important. I can do anything for 1 minute, and I am meeting my baby soon were extremely helpful during labor.
Excellent. Yes. Thank you for having me. This has been fun.
Thank you so much for joining us.
Thank you.
Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.